So on behalf of the National Lung Cancer Audit, I was pleased to be able to present the results from the annual report that was published earlier this month. The report looks at lung cancer data for patients who were diagnosed in 2019 and 2020. And there are a couple of really important standout findings from the report. So first of all, the data that was used was a brand new data set. So this is slightly different to previous years, and there are a few different issues around the analysis that are described in detail in the actual report. But it resulted in, the new data set resulted in approximately 4,300 patients with poorer prognosis not being included in the 2019 and 2020 data sets. The second really important point is that the results for 2019 were probably the best that we've seen to date, monitoring data for lung cancer over the years. So we showed that 1 year survival was approaching 41%, so much higher than it's been in previous years. So this is, a real testament to lung cancer teams out there, that care was really improving. And a lot of the things that teams were working on, like engaging with early diagnosis initiatives, working on their lung cancer pathway, and engaging with newer treatments, newer technologies, all were having a real positive effect on lung cancer outcomes. And then the third really important thing, and I think the thing that people probably take away most from the report, is the impact that the pandemic has had on lung cancer patients in 2020. So there's a couple of key things from that. So first of all, the incidence of lung cancer was slightly lower. So we detected fewer lung cancers, about 2,000 fewer in 2020 compared to 2019. We found that patients had a worse performance status, so fewer were likely to have performance status of 0 to 1. We also found that patients were less likely to have treatment with curative intent. And actually the surgical resection rate, which for years has been a very important metric for lung cancer outcomes, showed a significant drop from 20% in 2019 down to 15% in 2020. So this really takes us back to a surgical resection rate of 10 years ago. So these are some of the key findings from the report that I was able to outline during my talk at the British Thoracic Oncology Group today.